Hello, my name is Melissa Smith, and you are viewing my video presentation of the spiritual needs of a special patient population for the course Spirituality and Nursing, the Cultivation of Nursing as Ministry for Bon Secours Memorial College of Nursing. In this presentation, I will explore a particular patient population and discuss the unique spiritual needs seen across that population. I will select a spiritual assessment tool for the population and discuss why I feel it is appropriate. And finally, I will provide a summary of nursing interventions that could be used to meet the spiritual needs of this unique population. The population that I've chosen to explore are middle-aged adults with congestive heart failure in the acute care setting. I chose this patient population because of the time I've spent with those diagnosed with heart failure during my clinical immersion on the telemetry unit at St. Mary's Hospital. I chose this particular age group of middle-aged adults because when I initially started my immersion, I assumed most of my patients would be elderly. But over the last 12 weeks, I've cared for several men and women between the ages of 40 and 65, either receiving an initial diagnosis of heart failure or being admitted for an exacerbation. Heart failure remains one of the most disabling conditions, carrying a high economic burden related to the frequency of hospital readmissions, and 50% of patients die within 5 years of receiving a heart failure diagnosis. The spiritual needs of these patients include things such as their quality of life, their ability to perform activities, and coping with a diagnosis that has a high mortality rate. Patients diagnosed with heart failure experience various physical and emotional symptoms such as dyspnea, fatigue, edema, sleeping difficulties, depression, and chest pain. These symptoms limit patients' daily physical and social activities and result in a poor quality of life. And a poor quality of life is related to high hospitalization and mortality rates. Because these are middle-aged patients, it is safe to assume that many of them are still working, and their diagnosis may affect their ability to continue doing so. This may result in depression, shame, or guilt associated with role strain. One study on the spiritual needs of heart failure patients found that the extended deterioration and uncertain cyclical pattern of acute decline, juxtaposed with moderate improvement, appear to affect the patient's sense of isolation and spiritual well-being. As I mentioned earlier, the physical aspect of quality of life is especially important in this population. The spiritual well-being of individuals with heart failure tends to follow the fluctuation of physical symptoms, and the degree to which a patient experiences physical symptoms has been inversely correlated to spiritual well-being. The body of qualitative literature on advanced heart failure has focused on describing the spiritual needs of these individuals. Some individuals describe needs for love, peace, happiness, and transcendence. Several studies found that these individuals were seeking hope. This need for hope could be, a desire to take a positive outlook on life and maintain a fighting spirit. Another common spiritual theme for this population is regret and resentment. Individuals experience regret about their past behaviors that they viewed as having caused their heart failure. Often these patients are looking for meaning and purpose. They try not to take things for granted and realign their priorities. These patients related a desire to assign a cause to their illness and find some purpose for their current and future states within the new context of a chronic terminal illness. Another common spiritual need for these patients is connectedness. Individuals, they want to maintain relationships with families and friends, as well as transcendent connections with a higher power, nature, or humanity as a whole. The spiritual assessment tool I chose for this population is the FACT tool. I like this tool for this population because it aligns really well with the spiritual needs that I mentioned earlier to be common for these patients, and each category has several options for questions you can ask. If you have the time and feel comfortable, you can ask all of them or just one or two. The first category is for faith and belief. The question that I really like in this category is, what things do you believe give your life meaning and purpose? Because as I mentioned earlier, the literature states that meaning and purpose are the most consistently mentioned themes regarding the spiritual needs of patients with heart failure. The next category in the FACT tool is active, available, accessible, and applicable. It focuses on asking if the patient is active in their faith community and if support for their faith is available to them. The question that I really like in this category is, do you have access to what you need to apply your faith or beliefs? This question can be used even if the person is not a member of an organized religion, and it gives the interviewer an idea of whether the patient's current medical state or hospitalization is affecting access to their spiritual needs. The next category is coping, comfort, conflicts, or concerns. This category is so important for this population because it directly asks how the patient is coping with their medical condition. This category also asks if the patient's beliefs conflict with their medical treatment, and it asks whether the patient has any particular concerns for the medical team. This gives the patient the opportunity to express their feelings about their diagnosis. And I've found that often patients, they just want to be heard and know that someone is listening, and this question allows them to do so. The last category in the FACT spiritual assessment is focused around the treatment plan, and this just gives the person conducting the assessment an idea of how to proceed based on the answers to the questions in the previous categories. Now I'm going to provide a brief summary of interventions for patients with congestive heart failure in the acute care setting. One of the first things that I would do for these patients would be to conduct a spiritual assessment. It gives you a better idea of how hospitalization and a diagnosis with a chronic condition is affecting the patient. It gives you information about what is important to them, what they need, and what they lack access to. Some simple interventions that I would be able to provide immediately in the acute care setting during my care would be to provide a meaningful presence, to listen actively, use therapeutic touch, encourage the patient to reflect and remember. I could pray with the patient or encourage them to pray and offer chaplaincy. I would also collaborate with and inform case management of my findings during the spiritual assessment to ensure their spiritual needs are being met after discharge. Finally, I would provide resources for support groups to those with the same diagnosis and inform the patient of the many benefits of participating in support groups. And that brings me to the end of my presentation. To summarize, I've provided you with some background information about challenges faced by middle-aged adults with congestive heart failure in the acute care setting. I have discussed the unique spiritual needs of this patient population. I have also provided information about the FACT spiritual assessment tool and how it is helpful for patients dealing with a chronic illness. And finally, I have discussed spiritual interventions that can be easily implemented by the nurse in the acute care setting. I hope you have enjoyed my presentation, and thank you for your time.